Hello, everybody. Dr. Alex Vasquez coming to you live right now to give some context to something that I sent out yesterday. So yesterday I sent out kind of an initial organized index of what I've previously published as something called Health Homework. Health Homework, as the name perhaps suggests, is a list of things that you might consider and I might consider doing to maintain and optimize health. So for example, like looking at certain lab tests, looking at certain either physical exercises or mental exercises in order to, again, kind of push the envelope toward the direction of better health in a lot of different ways, and health includes, a lot of different activities, not simply, exercise and taking vitamins, but, looking after and kind of nurturing your own creativity. So, for example, as an aspect of being healthy, being self-assertive, working on issues around self-esteem and finances. I mean, all of that is included within a broader conceptualization of health, not just having whatever normal blood pressure is or something like that. So, what I noticed as I was organizing that list of the previous health homework exercises is I think it's a good list. Obviously, I mean, of course I made it. Most of the time I made that list pretty spontaneously, so it's not necessarily super organized. Probably most of the time it was just stuff that I did in my own life, and then I decided to talk about it. In contrast to that kind of spontaneous presentation of concepts, I do of course have a very organized presentation of a lot of those concepts, and that's of course in my book, Inflammation Mastery. So for example, in chapter 2 of Inflammation Mastery, the entire chapter is dedicated to something called Reestablishing the Foundation for Health, and that is a specifically naturopathic medicine concept and is actually a core component of naturopathic medicine. It's not just a side dish or something that's available on the huge buffet of naturopathic medicine, but it's actually like a core component. And again, that's the entirety of chapter 2 of Inflammation Mastery. That chapter, even though it's rooted in naturopathic medicine, I actually created that when I was in private practice in Houston, Texas, because I saw that a lot of my patients needed, some basic foundational advice. They would come in for treatment for whatever, psoriasis or rheumatoid arthritis or fibromyalgia or IBS, but, inconsistent with the medical model, which is to treat diseases very specifically. The naturopathic model, to its credit, looks at the, entire person and entire environment, not simply whatever their presenting complaint is. So again, even though in the Health Homework series, a lot of those are somewhat randomly selected and presented, I do have a very organized presentation of those concepts, again, in Chapter 2 of Inflammation Mastery. However, I also talk about it a little bit in the introduction in Chapter 1, and I'm going to use that kind of as a model for what I want to say right now, which again occurred to me as I was looking at those items that I was presenting yesterday in yesterday's blog and the previous posts under that heading of Health Homework. And the concept is this, without a strong foundation, what the naturopaths would call reestablishing the foundation for health, without that foundation, everything else is just window dressing and spot welding, basically. So all of us have to maintain and protect and defend and kind of sustain, again, that foundation of health, which, has at least some basic 3 core elements, I would say. I mean, we could make the list longer or shorter, but can't make it much shorter than 3. But let's at least go with 3. And so, again, it occurred to me last night when I was kind of making that list. It's in the books, but I haven't really explained it in videos and blogs for the website. Probably because I already know that I've explained it elsewhere. But now I want to, take a step back or look back, so to speak, and make sure that everyone's on board with this concept. So, what we're looking at on the screen right now is, of course, as it says, Chapter 1, Initial Considerations in Patient Assessment and Management. And I'm going to walk us through this chapter. Toward the end of the chapter is a diagram that I want to focus on. But since a lot of you probably haven't ever seen the inside of the book, this is a chance for you to see the inside of the book as well. So, Chapter 1 is kind of like core, what we would call at Bastyr. What did we call it at Bastyr? Core competencies. So, my naturopathic education was unique, differentiated from chiropractic and later medicine, osteopathic medical education. So, thankfully and fantastically, my chiropractic education was very different from my naturopathic education. And my naturopathic education was very different from my osteopathic medical training. And I'm grateful that they were all so different. But again, despite that short tangent, I'm going to focus on a few things that are both naturopathic and chiropractic. So let's just go through this. Oh, here's how I got onto that tangent. And that is at Bastyr, uniquely at Bastyr, we didn't have this in chiropractic, we didn't have this in medicine. But we had an emphasis on what we called core competencies. And so obviously I was a student at Bastyr, and then I graduated, and later I taught orthopedics and rheumatology there. And that's how I ended up writing these books, is because I took my course notes from those courses that I taught, orthopedics, rheumatology, and radiographic interpretation. I took those course notes and turned it into these books eventually, obviously over the course of much time. But this chapter is kind of basically the core competencies of clinical medicine. Patient assessment, risk management. A little bit of this was also emphasized in my chiropractic education. A lot of patient management, which again was awesome. And the interesting thing is we didn't get any of that in medicine, because medical education these days is really geared toward creating residents to work in hospitals. It's not really created to develop primary care doctors anymore. I presume that it was, 40 or 50 years ago. But these days, by requirement, medical students have to go into hospital-based residency programs. And so medical education doesn't prepare them for clinical practice anymore. It prepares them, here we talk about lab tests on the screen, it prepares them to work in hospitals as hospital slaves, basically. In contrast, chiropractic education is designed to create clinicians. Naturopathic education is designed to create competent and successful clinicians. And so the educational process is very different. So like I said, in order to provide contextualization for the health homework exercises, I need to talk about reestablishing the foundation for health, and I'm going to use, again, that's chapter 2, but from chapter 1, I'm going to use one of the diagrams that's typical for within chiropractic education and chiropractic philosophy, basically. So while we're getting there, I'm showing you what's on the inside of Inflammation Mastery, chapter 1. So this chapter is 186 pages. It's a lot of information. You can see here I talk a lot about risk management because I had to teach that. First of all, I had to learn it. I had to learn it in chiropractic. I had to learn it again in naturopathic medicine. And then I had to teach it when I taught orthopedics and rheumatology, because those are high-risk topics. Dermatology typically is not a high-risk topic. We don't see too many emergencies in the category of dermatology. But in orthopedics, you better be damn sure you know how to identify emergencies. And in rheumatology as well. So I had to talk about risk management in the courses that I taught. Oh, and here they are. So here I am on page 119, and I talk about musculoskeletal emergencies. Very important topic. Neuropsychiatric lupus, giant cell arteritis, temporal arteritis, acute red eye, atlantoaxial instability, myelopathy, transverse myelitis, Cauda-Equina syndrome, acute compartment syndrome, obviously septic arthritis. So those are all orthopedic and rheumatologic musculoskeletal emergencies. Okay, so here I get into naturopathic medicine. So this is emphasized more in chapter 2, but I'll go ahead and read it since I have it on the screen right now. A brilliant statement by Jared Zeff. This is out of the Journal of Naturopathic Medicine. I think it was around, 1997, a long time ago. He says, the work of the naturopathic physician is to elicit healing by helping patients to create or recreate the conditions for health to exist within them. Health will occur where the conditions for health exist. Disease is the product of the conditions which allow for it. Amazing statement and very clear. He, of course, articulated it, but I'm sure he didn't originate it because that is a core value of naturopathic medicine. Health occurs where the conditions for health exist. Disease is the product of the conditions that allow for it. So, that again, foreshadows the naturopathic profession's emphasis on environmental medicine and, social contextualization, which of course I talk about virtually all the time in my own work. Some other major concepts of naturopathic medicine. This is me in the picture being a barefoot doctor, which is another concept in naturopathic medicine and also even allopathic holistic medicine. They like to think of themselves and talk about themselves as being barefoot doctors, but I actually was a barefoot doctor in this picture. This picture was taken right outside of Portland, Oregon, in an area where I used to go hiking. So I used to go there virtually every weekend. The next section talks a little bit about functional medicine, and then we get into chiropractic, and that should be right here. So I want to focus on this diagram. So we're on page 152. I'm going to expand that page just so we can look at it a little better. And so again, when we're talking about reestablishing the foundation for health, I want to use this as a model. And I'll give you some quick examples, and then I'll wrap up this kind of short video introduction overview. So the way that this occurred to me actually just this morning was to present the introduction to health homework using the chiropractic model, what we call the triad of health. So I'll read the quote from Daniel David Palmer. He was the founder of chiropractic in the United States. The human body represents the actions of three laws, spiritual, mechanical, and chemical, united as one triune. As long as there is perfect union of these three, there is health. So let's use this just again, kind of as a discussion point and a model. And the way that I want to phrase this model, again, to help contextualize the other exercises in health homework, is to say you can't just do health homework exercises and expect to be healthy, basically. They're important, they could be life-saving, but you still need to have the foundation. So let's at least talk about what the foundation is. And I think this is a perfect way to talk about it. And that's obviously why it's part of the chiropractic model. So the foundation that I maintain and that I encourage you to also maintain is that you have to kind of take care of these three bases. Chemical, which includes nutritional and hormonal. So an obvious starting place is diet. You have to have a good diet. You can't just eat junk and then take some vitamins on top of that and expect to be healthy. It doesn't work like that. Ultra-processed foods, alter human physiology and brain function and gut microbiome in ways that you can't compensate just by taking, some supplements. So your diet has to be solid. The diet that I've introduced over the past 20 years is what I call the Paleo-Mediterranean diet. So it takes the best of the paleo diet, which was actually popularized a long time ago, but more recently by Loren Cordain in his book called The Paleo Diet. So I call it, again, the Paleo-Mediterranean diet. So it's paleo and a little bit Mediterranean. What do you get from Mediterranean? Olive oil, red wine, and again, unprocessed foods is the goal. So the way that I described that is adequate protein, minimal carbohydrates, and an abundance of fruits, vegetables, nuts, seeds, and berries. And I describe it that way for very, very clear reasons. But it's a whole food diet. Mediterranean diet, and paleo diet, but really more paleo than Mediterranean. I lived 15 minutes from the Mediterranean Sea when I lived in Barcelona, and believe me, Mediterranean diet these days doesn't really mean much. If you look at what people eat along the Mediterranean, it's pretty much ham, cheese, bread, and it's just not a healthy diet. So you have to look at the original version of the Mediterranean diet, which is sometimes called the Crete or Greek Mediterranean diet. But again, living along the Mediterranean doesn't provide some miracle diet. It's just a label that we apply to the diet that originated from that region. But again, it's mostly the Greek or Crete Mediterranean diet. That's more like the hardcore Mediterranean diet. So my 5-part protocol is the Paleo Mediterranean diet: fruits, vegetables, nuts, seeds, berries, adequate sources of protein, minimal carbohydrates. Boom, there it is. Does that include pizza? No. Does that include pastries? No. Can you eat those things on an irregular basis? Once or twice a month or something like that? Yeah, especially if you're exercising, So, one of the ways to justify carbohydrate intake is to use it to replenish glycogen that you've burnt off while doing exercise. So if you love sweets, then one of the ways that you can make a deal with yourself is that, you get to eat more sweets if you're doing, high intensity exercise, because you actually need to replenish that glycogen. The other 4 components of my 5-step program, and I'll put my article on the website when I post this video. I published this in 2004, 2005, and then I published it again in 2011, and of course it's in my books. But again, it's called the 5-part Paleo Mediterranean Diet Protocol. Paleo Mediterranean diet: fruit, vegetables, nuts, seeds, berries, lean sources of protein, minimal carbohydrates, or carbohydrate per exercise utilization. Multivitamin, multimineral is the second part. On top of that, we add some extra vitamin D because most multivitamins don't contain enough vitamin D. That's the third part. Fourth part is combination fatty acid therapy. I've got an entire video on that. Hopefully most of you have seen it by now, but it's called CFAT, combination fatty acid therapy. ALA from flax oil, GLA from borage oil, EPA and DHA from fish oil. And then the 5th component is probiotics, or something to address the gut microbiome, because probably most people have dysbiosis if their diet is anything less than, pretty much getting close to perfect. So again, when I talk about these exercises under the heading of health homework, you still have to have this foundation supporting all those exercises. For the top of the pyramid here, mental, emotional, neurological, spiritual. So part of that, from a chiropractic perspective or standpoint, would include, getting adjusted when you need to get adjusted. I still think that the chiropractic adjustment is an almost miraculous tool when applied at the right time, in the right situation. I've had, in my own case, I get some recurrent problems every once in a while that don't respond to anything other than chiropractic style treatment. And it doesn't necessarily, like in my case, it could be spinal, or it could be, costovertebral, like the articulations between the vertebrae and the ribs, so to speak. But if it weren't for my understanding that and getting treated in a chiropractic style, it could be osteopathic medicine as well, I wouldn't have a solution for that problem. So I'll tell you what it is, just for the sake of clarity. And for example, I'm kind of fascinated by it, even though I've had this problem for 15 years or whatever, and it's real basic. But what I've noticed is that, like, if I go traveling, or if I have to carry like a heavy bag or something like that, a backpack or a suitcase on my shoulder or something like that, if I carry it on my left side, I don't have any problem at all. If I carry it on my right side, I'm guaranteed, even if I just carry a backpack for a few minutes, like, it's virtually like on contact. If I put a backpack on my right side, on my right shoulder, I'm almost guaranteed to start getting like an eye twitch. So my right eye, after I do that, and like, I'm not making this up. I couldn't make this up. I'm not that creative to make up something so completely, apparently ridiculous, but it happens. So if I put a backpack on my right side, I get this like stupid eye twitch. My eye just starts twitching like crazy. Has apparently little or nothing to do with my spine per se. But again, if I put the backpack here on my shoulder, I'm guaranteed to get an eye twitch. And then it just twitches and it just is stupid. What do I do with the stupid eye twitch? So through a little bit of trial and error over, so many years, what I've found that in my own case, if I put a heavy bag on my shoulder and I get that eye twitch, if I get my second or third rib adjusted on this side, like high velocity, low amplitude, what we call HVLA, and again, that could be osteopathic or it could be chiropractic. But if I get that rib adjusted, I have no more eye twitch. So I can't really explain it like on a neurophysiologic level, but it's just an example. It's one very simple example of the value of high velocity, low amplitude chiropractic style adjusting that sometimes, solves problems when nothing else does. So that's just one example. But again, from the chiropractic, triad model here, we have to talk about like emotional and mental health, right? So let's say you do all the exercises I tell you in Health Homework, and your diet is perfect, 5-part Paleo-Mediterranean diet, fruits, vegetables, nuts, seeds, berries, lean sources of protein, carbohydrate intake tailored to your exercise. Boom, you got your diet perfect. You're taking a multivitamin, multimineral, you're making sure your vitamin D is optimized, as I've shown you before. You're taking combination fatty acids, and you've got probiotics and other ways of, perfecting your gut microbiome. So you're doing everything great. But let's say you're in an abusive relationship or something like that. Sorry, my screen just went black. Let's say you're in an abusive relationship and you're getting your ass kicked by your partner or by your boss or by whoever in your life. Then, from a common sense perspective, you wouldn't expect to be healthy if your diet and your supplements are perfect, but you're getting your mental and emotional and spiritual ass kicked every day by your work environment, or maybe even by your local or national society that you're just incompatible with your own country or whatever. Or like in my case, I had a job that I loved with students that I loved, and I was working under administrators that were stealing money from the school. They were stealing student scholarship money. And so I was trying to teach at a high level of integrity and excellence under a group of upper administrators that are stealing from my students. So that was one of the worst experiences I've ever had in terms of feeling brutally abused by this work environment that I was also at the same time attached to, and I was trying to make it work, So obviously I talked about that in another publication. You can read about that to get the details. But what chance did I have of being physically healthy, even though I was exercising and even though I was taking supplements and even though my diet was good? I was actually physically the healthiest I had ever been. I mean, I was running every week. I was biking. I was hiking. I was in great physical shape. But I was getting my ass kicked mentally, emotionally, and spiritually by my bosses because I was, very engaged and involved with my work of teaching these students, and yet I was working under people who were stealing money from the school. So that was a horrible experience. But I use that as an example of how all these things have to, rhyme and reason and work together in order for all of us, me included, obviously, for all of us to kind of manifest the level of health that we want. And physical, structural, again, that's where the chiropractors would say, your nervous system, top of the triangle, is at least partly dependent on your physical health and your structural integrity. So physical includes, spinal function, alignment, joint function, and also, of course, exercise. So again, just to provide some context to the various exercises, I think I'm up to 40 different exercises in Health Homework. Yeah, all of those are worth considering. That's why I talk about them. But you still got to have that core foundation. of an optimized, clean diet. It could be paleo. It could be described as paleo. You can describe it as keto. It could be more Mediterranean. You could even be vegetarian or vegan, but you got to know what you're doing. If you're vegetarian or vegan, you can't just say, hey, I'm going to eat plants and everything's going to be fine. I mean, you got to know how to supplement certain nutrients, especially iron, zinc, vitamin A, and B12. Again, if you're exercising on a regular basis, doing some sauna or some hot tub or some sweating and then some cold showers, all of that's great. But again, if you're not setting boundaries, or if you're in a bad situation where you love or need your job, but you're getting abused by your bosses, or you love your family, but one of your kids or one of your relatives or somebody that you're connected to, if they're abusive toward you, then that's going to take a toll, And at that point, sometimes you can compensate for those types of abuse with certain supplements, magnesium, zinc, vitamin B6, for example. Those help to kind of deal with stress. But that's not the long-term solution. You've got to have a strong foundation for health, just like the naturopaths have always said. And this is a way of kind of modeling that or envisioning it. Chemical, nutritional, hormonal, mental, emotional, neurological, spiritual, and physical, structural, including exercise and physical detoxification, like sweating, sauna, hot tub, jacuzzi, coffee enemas if you want to. I mean, that's a way of kind of stimulating the liver to detoxify. So again, this is kind of a broad and general overview, but I wanted to provide you some context and a bit more information for what we talk about when we're talking about health homework. It can't simply be, some random exercises. It has to be those exercises on top of a strong foundation. Let's see if we have anything else worth talking about in chapter 1 here while I'm looking at it. I mean, obviously it has things worth talking about because that's why I included them. So here, just like in the health homework series, I talk about iron overload. You don't want to have too much iron. You don't want to have too little iron. So I talk about that here. You've seen this diagram. These are the complications of too much iron. This is called hemochromatosis. Commonly presents with musculoskeletal pain in the hands. Can be the spine as well, also the knee and shoulder, as you can see here. So let's see, hypothyroidism. So I think I only talk about hypothyroidism. I don't know if I talk about adrenal insufficiency here. It's not quite so common. So, in the chiropractic model, so here I talk about hypothyroidism. Virtually everything you need to know about hypothyroidism is there. But let's go back and look at that chiropractic model, and then I'll close out this video. Again, you've got to make sure that you've got the core components covered. And again, within the chiropractic model, that includes chemical, nutritional, and hormonal. So you want to make sure that you've got your diet and vitamins and supplements kind of nailed down. And then you have to look at other things. And that could be, hypothyroidism is very common. As people get older, they have, imbalances between estrogen and testosterone. Not simply deficiencies of hormones, but imbalances between them, because of course testosterone and estrogen are kind of antagonistic. And anybody could be susceptible to having thyroid problems or even pituitary problems, especially excess prolactin, for example, is a problem that we see in patients with autoimmune conditions. And of course I talk about those in other parts of the book. But again, wanted to give you some context and perspectives on implementing those health homework exercises. Yeah, you should think about them. Some of them you should probably do. But again, you still have to have a core, solid foundation built on these 3 pillars of chemical, nutritional, and hormonal is one. You want to make sure your diet is solid and your hormones are balanced. Getting exercise is pretty simple for most people, and I'm not saying that you have to have, a lot of equipment or anything like that. I mean, you can do a lot of exercise just in your own house, with or without equipment. So it takes a little bit more discipline and creativity sometimes, but it also saves you a lot of time and can save you a lot of money. So for example, like if I want to go to the gym, the closest good gym for me is more than an hour away. In contrast, if I do exercise at home, I can knock it out in 30 minutes, and I'm getting 30 minutes of value for 30 minutes of investment. If I do, as I have for a lot of my life, even when I lived in Houston, Texas, I would still have to drive 20 minutes just to get to the gym. And I had to. I was a power lifter at the time. But 20 minutes there, 20 minutes back, packing my bag, getting my stuff ready. It's an hour just in preparation just to do a 45-minute workout. So I'm investing 2 hours to get 45 minutes worth of value. So, that's one of the benefits of having a routine that you can do at home. And these days, of course, you have apps, you can watch videos. But I encourage you to look at making your exercise program efficient so that you're getting a lot of value for the time investment. Like I said, I exercise at home. If I work out for 30 minutes, I get 30 minutes of value. If I depend on a gym, 45 minutes there, 45 minutes back, that's an hour and a half just to work out for 30 minutes to an hour. I'm not getting a good return on that investment. And again, mental, emotional, neurological, spiritual health. Sometimes it means you've got to quit your job. And I've quit all of my favorite jobs that I've had. I've quit all of them. Or I got, in the case of that academic position, they actually fired me because they knew I was onto the thievery that was going on. But I've had other jobs that I worked very hard for that eventually I had to walk away from just because it was completely abusive. And relationships too. I mean, I used to be head over heels for some of the people I had relationships with in the past, and probably I knew it at the time, but obviously it's more clear, being out of that situation. But some of those relationships were abusive, so I've had to extricate myself from certain work environments that were abusive, and the same thing is true of emotional and social relationships. Including some of my friends, like I broke up with one of my best friends 2 years ago. Now it's 3 years ago. It was in 2022, and we had been best friends since we were 11 years old. And he sat behind me in science class, and we just became buddies, from a very young age. And then, we were reasonably good friends for 40 years. Some of that time we were out of contact just because we lived in different countries. But, that was a relationship that I also had to let go because it was it just wasn't healthy it wasn't healthy for me, and it wasn't really fun or beneficial for either one of us. We had just grown apart as to be expected over those 40 years. So, I'm telling you that at times you have to leave jobs, you have to leave people, you have to leave your most favorite, passionate, intense, romantic relationships, and sometimes you have to change countries in order to, protect and cultivate and nurture your own spiritual and emotional health. So I'm telling you, it's probably true for you. I know it's been true for me, and I've lived it. I've relocated and changed jobs and quit jobs and broken up with some of my favorite people along the way just because it was necessary in order to maintain my own physical and mental health. I'm not saying it's easy, but I am saying it's necessary. So again, think about using this model as kind of the foundation for health, making sure your biochemistry is good, nutrition and hormones to start with, and also detoxification of the chemicals that we're all exposed to. Mental and emotional and spiritual health is important, and physical, structural health, including maintaining and moving your body with different types of exercise, aerobics, stretching, strength training, some type of practical skill. I think is a fourth category worth considering. That you can and perhaps should get more out of exercise, not simply movement and warming up your body and sweating for a while. That's great, but every once in a while you should throw in some skill work in there as well, like martial arts or hitting a punching bag or kicking a bag or something like that. But something that has practical value in addition to exercise and sweating and stretching and all that kind of stuff. All right. That's all I wanted to say. Hope you're doing well. Talk to you later. And I'll get this on the website as soon as I can. Dr. Alex Vasquez coming to you live from inflammationmastery.com. That's used to be my main website. Now I use Substack. I talk about virtually everything on healthythinking.substack.com, and I try to keep it more strictly clinical at inflammationmastery.substack.com. So hopefully you're following me on one of those platforms, and like I said, I'll get this on the website as soon as I can, and I'll get some more information up there as well. Take care. Bye.